There is a very specific and very frustrating experience that many people know immediately, but almost no one talks about comfortably. It is that moment when you feel the urge to have a bowel movement, you go to the bathroom, you sit down, you push a little, and it seems like the stool has traveled all the way to the very end, but then it simply stops. It feels as if it is right there, almost out, and yet it will not leave. Not because you do not have the urge, not because nothing is there, but because something at the very exit seems to be holding it back. For some people, this creates long, uncomfortable minutes in the bathroom. For others, it becomes straining, repeated attempts, the feeling that more stool is still inside, or the strange sense that the body is trying to empty but cannot quite finish the job. And what makes this so discouraging is that many people immediately assume the same thing. They think, I need more fiber, or I must not be drinking enough water, or this is just part of getting older. But in many cases, especially when stool feels stuck right at the exit, the real issue is not only what is happening higher up in the colon, it may be happening at the final doorway. Discover the surprising reason stool gets stuck right at the exit and learn simple science-backed tips to improve bowel movements naturally. Watch until the end for practical advice that can help support better digestive health. If you find this video helpful, like, subscribe, and turn on notifications for more trusted health and wellness tips. And once you understand that hidden cause, the entire problem starts to make much more sense, because this is not always a story of stool being absent. Very often, it is a story of stool arriving, but not being allowed to leave smoothly. And today, I want to walk through exactly why that happens, what your body may be trying to tell you, the overlooked mechanism behind it, and the patterns that can quietly make it worse over time. And let me say this right away. The hidden cause I'm going to explain is something many people have never heard of, even though it may play a major role in chronic constipation, incomplete emptying, and that awful feeling that the stool is stuck at the very last inch. Before we go further, I would love to know this. When you deal with constipation, what is the most frustrating part for you? Is it hard stool, straining, the feeling that something is still left behind, or going but never feeling fully empty? Leave a quick comment and tell me what you notice most. These details matter because constipation is not the same experience for everyone. Now let us begin. But before I reveal the hidden cause, we need to make one short stop at the body's basic mechanics. Do not worry. This will be simple, practical, and very easy to picture. And once you see this clearly, the entire problem becomes much less mysterious. Think of your digestive tract like a long, slow-moving pathway. Food is broken down in the stomach and small intestine. Then what remains moves into the colon, where water is gradually removed and the stool becomes more formed. Eventually, that stool enters the rectum, which is like the body's temporary holding chamber. Now here's the important part. The rectum is not the final exit itself. It is the waiting room just before the exit. The actual release depends on a coordinated event involving muscles, pressure, timing, and relaxation. In order for stool to leave the body, two things have to happen at the same time. First, the rectum and abdominal muscles need to create pressure that moves stool downward. Second, the muscles at the outlet, especially the anal sphincter and the pelvic floor, need to relax and open. If both happen together, the bowel movement can be smooth and complete. But if the body pushes downward while the exit muscles remain tight, closed, or only partly relaxed, the stool can feel as though it is stuck right at the end. A simple image helps here. Imagine trying to squeeze toothpaste from a tube. If you press the tube and the cap is off, the toothpaste comes out. But if you press the tube while the cap is still on, the pressure builds, the tube strains, and almost nothing comes out. That is surprisingly close to what happens in many people with this kind of constipation. The stool reaches the end, the body tries to push, but the final opening does not relax the way it should. This is one of the most overlooked reasons stool feels stuck at the exit, and it has a name. It is often called pelvic floor dyssynergia, dyssynergic defecation, or outlet dysfunction. The name may sound technical, but the idea is actually very simple. The muscles involved in having a bowel movement are not coordinating correctly. Instead of relaxing at the right moment, the outlet muscles may tighten, resist, or fail to open enough. So the problem is not always that the colon is too slow. Sometimes the stool has already made the trip. The real problem is that the door is not opening properly. This matters because many people spend years treating only the stool itself. They add fiber, they add fluids, they try teas, powders, supplements, and all kinds of remedies. And some of those things can help, especially if stool is hard and dry. But if the outlet muscles are not working in harmony, then even softer stool may still feel difficult to pass. That is why some people say, I can feel it right there, but I still cannot get it out. That sentence is an enormous clue. Now, why would this happen? Why would the body fail to relax muscles that are supposed to relax naturally? There are several possible reasons. For some people, it develops slowly after years of straining. For others, it may appear after childbirth, pelvic injury, surgery, back problems, or changes in pelvic floor strength and nerve function. And in some cases, especially in older adults, the muscles and nerves involved in sensation and release simply do not coordinate as efficiently as they once did. That last point is especially important. As the body ages, bowel problems are often blamed on slowness alone. But the issue is frequently more layered than that. Changes in muscle tone, nerve signaling, physical activity, stool consistency, and pelvic floor control can all affect how well the body empties. So let us look at the signs that this may be more than ordinary constipation. The first sign is the exact feeling we have been describing. Stool seems to be right there, but it will not come out easily. The second sign is excessive straining, especially when the urge is present, but the result is disappointing. The third is incomplete evacuation, that frustrating feeling that something is still left behind even after you are finished. The fourth is needing repeated trips to the bathroom in a short period of time. The fifth is needing to change body position, rock back and forth, or sit for a long time just to make any progress. And in more advanced cases, some people feel they need to use a finger or apply pressure around the area to help the stool come out. That is not something people usually mention casually, but it is a known pattern, and it often points toward an outlet problem rather than a simple lack of fiber. Now, here is where many people get confused. They assume that if stool is stuck at the exit, it must mean the stool is too large. Sometimes that is true. Hard, dry, bulky stool absolutely can create a blockage-like feeling. When stool moves slowly through the colon, too much water is removed and it becomes dry, lumpy, and difficult to pass. In that case, the stool itself is part of the problem. But the reason I am focusing on the hidden cause is that a surprisingly large number of people are dealing with two issues at once. The stool may be too dry, and the exit may not be relaxing well. When both happen together, the experience becomes especially miserable. You feel pressure. You feel urgency. You feel that something should happen, but instead of relief, you get effort, frustration, and that repeating cycle of trying again later. Now let me mention another overlooked piece of the puzzle. Sometimes the problem is not only muscle coordination. Sometimes the rectum itself becomes less responsive. In some older adults, the sensation of stool inside the rectum becomes duller over time. That means the body may not recognize the need to empty until the rectum is already quite full. By the time the urge becomes obvious, the stool may be larger, drier, and more difficult to release. So the person says, I did not feel much for a while, and then suddenly it felt urgent. That pattern can make straining worse, and straining over time can further disrupt normal bowel mechanics. This is one reason constipation can become such a stubborn loop. The body empties poorly. Stool stays longer, it dries out more. The next bowel movement is harder. More straining follows. The pelvic floor becomes even more tense or uncoordinated, and the cycle keeps feeding itself. Now, there is another hidden cause that can create a very similar feeling, especially in women, and it deserves mention here. It is called a rectocele. A rectocele happens when the wall between the rectum and the vagina weakens and part of the rectum bulges forward. When that happens, stool can collect in that pocket instead of moving out cleanly. The person may feel pressure, incomplete emptying, or the sense that stool is trapped right near the exit. This does not happen to everyone, of course, but it is one reason the phrase stuck at the exit should not be dismissed casually, because the sensation is real, and behind that sensation, there may be more than one contributing factor. Hemorrhoids can also complicate things. Now, hemorrhoids are not always the main reason stool gets stuck, but swollen tissue around the anus can make the area more sensitive, more uncomfortable, and sometimes less able to close and open normally. When pain enters the picture, people may unconsciously tense the area, which can make bowel movements even harder. Anal fissures can do something similar. If passing stool hurts, the body naturally becomes protective. Muscles tighten. Fear of pain increases hesitation, and a person may begin resisting the very process the body is trying to complete. So when people say, "I do not understand why this keeps happening," the answer is often not one single thing. It may be a mix of dryness, slow transit, outlet tension, poor coordination, pain, swelling, reduced activity, medication effects, and age-related changes in sensation. But if I had to highlight the one hidden cause that is most frequently overlooked when stool feels stuck right at the exit, it would be this: the body may be pushing, while the outlet is not truly letting go. That is the reveal. And once you understand that, several frustrating mysteries suddenly clear up. For example, why do some people eat more fiber and actually feel worse? Because if the outlet problem is significant, adding a large amount of bulk without improving the release mechanism can sometimes make the rectum feel fuller without solving the final passage problem. Why do some people say laxatives help only partially? Because laxatives may move stool downward or soften it, but they do not necessarily retrain the pelvic floor to relax correctly. Why can someone have a strong urge yet still feel blocked? Because urge and release are not the same thing. The urge is the signal, release is the action, and the action depends on coordination. This is also why bathroom posture matters more than many people realize. When the knees are raised slightly, such as with a small footstool, the angle of the rectum can become more favorable for emptying. It is not magic. It is simple anatomy. For some people, that change alone reduces strain because it helps align the final pathway a little more naturally. Breathing matters too. Many people bear down by holding their breath and tightening their whole abdomen, face, and pelvic region at once. That often increases pressure, but not always in the most useful way. It can turn the effort into a full-body strain instead of a coordinated release. Slow breathing and avoiding a panicked push can sometimes make a meaningful difference. Timing also matters. The bowel is often most active after meals, especially after breakfast. That is why many digestive specialists recommend allowing time for the bathroom after eating instead of constantly postponing the urge. Ignoring the urge again and again can teach the rectum to become less responsive, and that makes the cycle harder to break. Movement matters. When the body stays still for too many hours, the bowel tends to stay still too. Gentle walking, regular physical activity, and not sitting all day can support more natural movement through the colon. And when stool reaches the rectum at a better time and texture, the final step often becomes easier. Hydration matters. Fiber without fluid can backfire. When the body does not have enough water, the colon removes more from the stool, leaving it harder and drier. That is one reason some people say they are eating healthy, but still struggling. Medication review matters as well. A number of common medicines can contribute to constipation, including some pain medicines, some blood pressure medicines, some antidepressants, and others. That does not mean a person should stop anything on their own. It simply means the pattern is worth discussing with a healthcare professional if constipation becomes persistent. Now let us talk about something important. If this outlet problem is truly present, what usually helps the most is not endless pushing, it is retraining. This is where pelvic floor physical therapy and biofeedback often come into the conversation. Biofeedback is used to help a person learn how the pelvic floor muscles are behaving during a bowel movement and how to relax and coordinate them more effectively. In plain language, it is a way of teaching the body to stop pressing the gas and the brake at the same time. That image is worth remembering because that is what this can feel like internally. You are trying to go forward, but part of the system is still resisting, and that is why the experience can feel so exhausting. People sometimes blame themselves for this. They think they are doing something wrong. They think they are weak, unhealthy, or failing at a basic body function. But often it is not about effort. In fact, many people are already trying too hard. The problem may be that more force is not what the body needs. The body may need better coordination, better stool consistency, better timing, and less strain. That is a completely different way of thinking about constipation. And honestly, it can be a huge relief when people finally hear it. Because once you understand that stool can get stuck at the exit for mechanical and muscular reasons, not just dietary reasons, you stop blaming every problem on one missing vegetable or one skipped glass of water. Now, let me give you 5 very common mistakes people make when this issue starts. The first mistake is treating every type of constipation as if it were the same. It is not. Some constipation is mostly slow transit. Some is mostly dry stool. Some is medication related. Some involves pelvic floor dysfunction. And many cases are mixed. If you do not understand which pattern you are dealing with, your solutions may miss the real problem. The second mistake is straining harder and harder. That feels logical in the moment, but over time, repeated straining can aggravate hemorrhoids, increase pelvic floor tension, and reinforce the very pattern that keeps stool from coming out smoothly. The third mistake is adding large amounts of fiber too quickly. Fiber can be helpful, but more is not automatically better. For some people, a sudden increase causes bloating, fullness, and even more pressure. Gentle, gradual changes are usually easier for the body to handle. The fourth mistake is ignoring the urge because the timing feels inconvenient. The body likes rhythm. When bowel signals are repeatedly delayed, the rectum can stretch, sensation can dull, and stool has more time to dry out. The fifth mistake is assuming that because this is common, it must be harmless. Common does not always mean simple. And this brings me to a very important final section. There are times when constipation or stool getting stuck at the exit should not just be tolerated or self-managed indefinitely. If you have bleeding from the rectum, black stools, unexplained weight loss, ongoing abdominal pain, vomiting, a sudden major change in bowel habits, severe worsening symptoms, or constipation that lasts for weeks and interferes with daily life, it is important to seek medical evaluation. The same is true if you repeatedly feel blocked, need to use your fingers to help stool come out, or feel as though something is structurally wrong. And if one leg, your back, or your pelvic area has also changed in a way that suggests nerve or muscle problems, that deserves attention too. Because while this topic is uncomfortable, it is not trivial. Your body is not trying to embarrass you. It is trying to communicate. And sometimes the message is surprisingly specific. It is saying, "The stool made it here. The problem is at the doorway." That is the hidden cause so many people miss. Not always a lack of effort, not always a lack of fiber, not always just age. Sometimes it is poor coordination at the final step of elimination. And understanding that changes everything. It changes how you think about your symptoms. It changes why certain remedies may have failed. And it opens the door to more targeted help instead of endless frustration. So if you have been dealing with that sensation of stool stuck right at the exit, I hope this gave you something more valuable than another generic constipation tip. I hope it gave you a clearer map, because when the map is wrong, people keep walking in circles. But when the map is accurate, even a frustrating problem begins to make more sense. And that alone can be the beginning of real progress. If this video helped put words to something you have been experiencing quietly, give it a thumbs up so more people can find it. And tell me in the comments, when constipation bothers you most, does it feel like the problem is higher up in the belly or right at the very end? That one detail can reveal a lot. Take gentle care of your digestion, pay attention to what your body is signaling, and remember this. Sometimes relief begins not when you push harder, but when you finally understand what has actually been holding the door closed.